My name is Laura. I'm a physical therapy student that's going to be working with you today. How are you doing?
I'm good, thank you. How are you?
Good, good. So today I'd like to do a little bit of an assessment on your knee, but I'd like to first start by asking you a few questions. Does that sound okay with you?
Yes.
Okay, so can you tell me a little bit about what brought you in today?
Well, I've been having problems with my knee, as you said, for a long time. Started with a hockey injury that kind of got worse, and I eventually had the meniscus removed.
Okay.
And then things were good for a while after that, but then I started getting a bit of a sharp pain. I managed with Advil for a while, but it kind of slowly got worse, and then last September I had my knee replaced.
Okay. Yeah. Okay, so can you tell me about how the surgery went?
They said the surgery was great, successful, and I saw a physio there in the hospital. I was out on the third day, and then I was doing exercises at home, and kind of noticed that the incisions that they made were kind of getting a bit red and hot, and one of them was oozing. And then one day during the exercise I was bending my knee, and it kind of split open, and so I went back to the hospital, and they put me on an IV, and I was there for a while. So
Can you tell me how long you were in the hospital for? About?
So I think I was on the IV for only 3 days, but they kept me for 5. And then they sent me to go do my exercises and said come back to get antibiotics. Like 2 weeks after that.
So, okay. And how's it feeling now?
Good. Just kind of, they sent me to go see a physiotherapist because I'm on crutches. And I need to get off that. And I think my biggest complaint for the home exercise program is that I'm still very stiff.
Okay. Sounds good. We'll definitely work on that. And it sounds like you're pretty enthusiastic about coming here. Before we move on, I just need to ask you about if you have any other medical conditions.
The major one was I had prostate cancer in 2005, but they had extensive surgery to remove everything, and I'm cancer-free now.
Good to hear.
And I'm also type 2 diabetic.
And when were you diagnosed with that diabetes?
Oh, I think it was back in 1999. So yeah, it was 1999.
Okay. And how do you manage your diabetes?
When I was first diagnosed, I used diet and exercise to kind of keep everything under control, but now I use medications as well to help.
Okay, and we'll delve into your medications just shortly. I just wanted to ask you if you have any allergies.
Yes, I'm quite allergic to seafood.
Okay. Yeah. Okay. And now that we're in Alberta, you live in Alberta. It's not even anywhere near the ocean.
It's good. Yeah.
Good. Well, that concludes what I have to ask you about your medical history.
Okay.
Now I'd like to continue on a little bit about your medications, as I said.
Sounds good.
It's actually really important for me as a physio to know about your medications because it can affect some of the treatments that we do and how you respond to treatments.
Okay.
Are you currently taking any medications?
Yes, I brought a medication list.
Okay.
The receptionist called and
told
me to. So I'm on some for my knee and some for my diabetes.
Okay.
So I'm taking I might pronounce it wrong.
Yeah.
Vancomycin, Ramipril, and Lipitor.
Okay.
Yeah.
Okay. And some people don't know exactly why they're on their medications. Can you tell me a little bit about why the doctor put you on those ones?
Oh yeah, for sure. So the vancomycin is the antibiotic for the knee for the infection. And I wrote down how much I take. 500 milligrams 3 times a day. Lipitor helps control my cholesterol levels. And I take 10 milligrams once a day. And then the Ramipril is to help manage my high blood pressure. And I also take 10 milligrams once a day.
Okay. So, good. Thank you. And you were mentioning that you're also on some medications for your diabetes, correct?
Yeah, sorry. The pharmacy gave me 2 different
lists.
So, it looks like, I might pronounce this one's wrong again, metformin and glyburide. And I also know why I take those, obviously for my diabetes. But for the amounts, for the metformin, I take 500 milligrams 4 times a day, which is a lot, and the glyburide once a day, and that's just 5 milligrams. So, for the glyburide.
So 5 medications there. Do you take all of those by mouth?
Yeah. With water, So.
Okay. Well, Dennis, it's understandable that it may be hard to keep up with all those medications. Can you tell me how you are able to manage your medications and when to take each one of them?
Well, I have the pill dispenser, which helps me like every day, but I definitely struggle with the metformin. As I said, I have to take 4 times a day. I often forget the last one, the evening one. So
So you remember to take all of your medications except for that metformin at the end of the evening.
It's like a couple times a week I'll forget it.
Okay. Okay. Can you tell me how often that happens?
Yeah, like 2 to 3 times.
Okay.
Yeah.
Okay, sounds good. That pill dispenser, is an excellent way for you to remember your pills. It's really important though that you do take that metformin, so to manage your sugars for your diabetes. Now, can you remember any way that you could help remind yourself at home to take that medication in the evening? Notes or something like that?
Yeah. Well, we've tried a couple different things, but I think, as you said, like a note, we just bought sticky notes, sticky on one side, paper on the other, and we tried the fridge for a while because we eat every day.
Yeah.
But I think we're gonna try the bedside table because I need to take it like right before I go to bed without space. So
yeah, that's a great idea. You just gotta find something that works for you. So that sounds like a good plan. You can give that a try.
Yeah.
Now I need to ask you if there's any other medications that you're taking, including over-the-counter, natural health products, anything like that?
No.
Okay. Now let's just say you were to get a cold in the next few weeks. Hopefully you don't, but as it's flu season, you never know. If you were to get a little bit of a cough, what kind of medication would you take, if any?
Usually I just try like resting and taking some orange juice first.
Okay.
But if it's cough, I usually take the Buckley's syrup. So
okay, good. Yeah, it's always good, to stay healthy, but just in case if you need that medication, it's good to know.
Okay.
Who is giving you the information about the medication that you're on?
Oh, it's my local pharmacist. So he's a knowledgeable guy. I respect him. He really helps me out a lot. Actually, his number I think is on the bottom of this medication list.
Maybe I'll grab that after we're done today.
Okay, that sounds good.
Good. Have you noticed any side effects from your medications, Dennis?
Maybe, not sure. I think mostly good. Like my doctor says my cholesterol's down with the meds, and I have pretty good energy, and my diabetes is managed with the meds. I've kind of stopped managing it with exercise and diet, so all good side effects.
Okay.
I think the only thing is that sometimes I get pretty tired. So
Okay.
I don't know if that's a side effect or just getting old.
Yeah, it could be. Maybe we'll monitor that. Do you ever feel like it affects your daily chores or activities that you'd like to do or your sleep?
No, not really. I tend to nap more now, but it's just once a day, and I can do all my chores, and I think that's fairly normal.
Okay.
So,
yeah. But as I said, we'll continue to monitor that. Did the pharmacist you were talking about provide you with a list of side effects that would require you to seek medical attention?
No, I don't think so.
Maybe I'll grab that for you. That's something always important to have, just in case something were to ever happen that needed doctor referral or to go to the emergency room, heaven forbid it does happen.
Okay.
So I'll give you that at the end of the day.
That'd be good to have, thank you. Yeah.
Good. Now, as you may or may not know, smoking can affect how your tissue heals, especially after a surgery like the one that you had on your knee. Do you smoke or have you ever in the past?
I don't smoke now, but I did smoke for about 25 years.
Okay.
I quit when I was 45.
Okay.
So,
Good to know. I trust that you'll keep up that good habit.
Yes, I plan to.
And do you drink any alcohol?
No, we don't at all. So.
Okay, good. Now, would it be alright if we spoke about some common drug interactions about your medications?
Yeah.
Just one that I can think of. Now, as a physical therapist, I have your best interest in mind, but keep in mind that your local pharmacist and your physician can always provide you with a lot of education about your medications.
Okay.
Now, first and foremost, did you know that grapefruit juice can have some effect with your medication for your diabetes or your cholesterol called Lipitor?
I think I heard that.
Yeah, so it's best if you avoid grapefruit juice. It can affect how Lipitor works in your body.
Okay.
So yeah, you're on the right track thinking about that.
Okay.
And I'll send you home today with the drug interactions pamphlets so that you can remember that at home.
Yeah.
Okay. Now, with your blood glucose, do you monitor your sugars every day?
Yes. Usually I know when I'm really high or really low.
Okay.
Just get that sense, but I do before and after every meal, just as doctor told me to.
Yeah,
so.
that's really important to monitor that and how you're feeling.
Okay.
Good. Yeah. Good.
Perfect.
So, looks like things are going well with your medications. What I'd like to do now is to continue on with what we call an objective assessment. So we're just going to look at your knee and see how it's moving, and we'll continue on from there, if that sounds okay with you.
Yeah, thanks for going over all my meds with me. I didn't know if physios do that. And
yeah.
Nice to know that you care. Thank you.
Good. So we'll see you back in a few minutes.
Okay, sounds good.